Hi everyone, welcome to Learn Nursing with Anu. Today we are going to understand one of the most important and high yield topics in nursing research. Many students feel research as a dry subject, but trust me, research is simply a structured way of answering nursing problems we see every day in clinical practice. So, by the end of the session, you will clearly understand what research is, why we need it, type of research, and how it applies to patient care. Let's begin. According to Pollitt and Beck, nursing research is a systematic search for knowledge about issues important to nursing. In simple words, it means it is a planned, organized way of finding answers to nursing related problems. For example, if you notice that postoperative patients complain more pain during night shifts, instead of guessing, we conduct research to find why is it happening? Is staffing affecting pain control? Is medication timing appropriate? So that structured investigation is nursing research. Why do we need nursing research? Let's think practically. Why is nursing research important? It improves patient care. For example, research helps us develop better infection control protocols in ICU. It provides evidence for nursing practice. Instead of saying this is how we usually do, we say this is evidence based practice. It improves patient safety. Research on medication errors helped reduce dosage mistakes. It helps in policy making and administration. For example, nurse patient ratio research influences staffing policies. So, research is not theory alone, it directly affects our patients. A good researcher must be research oriented, who is curious and always asking why, efficient, who manages time and data properly, scientific, who follows systematic methods, effective, who is able to draw meaningful conclusions, active, who continuously learns, resourceful, who uses available materials wisely, creative, who thinks beyond routine, honest, maintains the ethical standards, economical, who avoids unnecessary waste, rigorous, who ensures accuracy and reliability. So, in simple words, a researcher must be responsible and sincere. Research can be classified in different ways. So, we will understand them one by one with clinical examples. Based on time dimensions, first one is cross-sectional study. This is done at one point in time. For example, we measure the prevalence of anemia among a group of people. So it gives a snapshot. Next is longitudinal study. This follows subjects over a period of time. It has three types, that is cohort study, like we follow smokers for 10 years to see if they develop a lung cancer. Panel study, same group is repeatedly studied, for example following the same diabetic patients every 6 months to check for any complications. Then we do have trend study. This is different samples from same population over time. For example, we measure the stress levels of nursing students every year, but not the same students. Next, we do have retrospective study where we look backward. That's imagine a patient diagnosed with lung cancer and we go back and check, did they smoke, were they exposed to pollutions, and we look back into their records. And other type is prospective studies. We look forward. For example, we select patients with smoking history today and follow them for 10 years to see who develops any kind of lung cancers or lung diseases. And we have sequential research, which is a combination of cross sectional and longitudinal methods. And we have time series research, which is repeated observation over time. Uh, Say, for example, recording ICU infection rates monthly for 2 years. Then we have repeated measures research. This is same subject measured multiple times, um, like measuring pain score before and after giving analgesics. Next classification is based on purpose. We have basic or pure research. This is done to gain knowledge, or we simply do it for our academic purpose, like studying how stress hormones affect immune function. And we have applied research, which actually solves practical problems like studying best wound dressing method for diabetic ulcers. We also have translational research, which converts research findings into practice, like implementing a new pressure ulcer prevention protocol based on research findings. The third classification is based on approach. We have quantitative research, which deals with numbers and measurable data. For example, measuring blood pressure levels in hypertensive patients and doing research based on that. We have experimental research, in which the researcher manipulates the variables. We have true experimental, which is random assignment is done. For example, postoperative patients randomly assigned to receive two different pain medications to compare the effectiveness. Also, we have quasi experimental. Here, the major difference is we don't have randomization. So, there is no random assignment, and we compare outcomes between like two intervention without randomizations. Then we have non experimental research, which is descriptive, which describes characteristics like prevalence of depression among cancer patients. And we have correlational, which examines the relationship between two things, two variables. It can be like relationship between stress level and blood sugar in diabetes. We have exploratory, which explores new areas. We have survey, which collects data using questionnaires. So, specific quantitative research types are clinical trials, where we test new drugs, evaluation research, where we evaluate the program effectiveness. The outcome research is like checking patient outcomes. Operational research is improving hospital systems. Methodological research is by developing tools. Secondary data analysis is by analyzing the existing records. Meta analysis is by comparing the multiple studies, and ecological studies by studying the population level data. So, for example, we are comparing the COVID infection rates between maybe two regions. And next one is qualitative research. The main focus on experience and feelings. So we have phenomenology, that is understanding lived experience. For example, experience of mother caring for an autistic child. We have ethnography. We are studying cultural beliefs and practices. For example, traditional beliefs about mental illness. We have grounded theory, which is a developing theory from data. We have case study. This is a detailed study of one patient. Historical research is studying past healthcare practices, and action research is solving immediate problems in clinical settings. Then the other group is mixed method research, which combines quantitative and qualitative research designs, and we have convergent, which collects both together. Explanatory sequential is quantitative first, followed by qualitative. Exploratory sequential is qualitative first, then quantitative. Embedded is one method embedded inside another, and for example, measuring patient satisfaction scores and also interviewing the patients. Then the fourth subdivision is based on settings. This is field research done in community, lab research done in a controlled environment, clinical research is done in hospital settings. Fifth classification is based on data collection, primary research, which is collecting the fresh data. Secondary research is by using existing records. For example, we analyze hospital records of stroke patients in secondary research. Now let's discuss an important and frequently asked exam question. Scope of nursing research. Nursing research has a wide scope in four major areas, that is education, clinical practice, administration and patient care. Let's briefly understand each one. Scope in nursing education. So, in nursing education, research helps improve teaching methods and learning outcomes. It supports curriculum development, evaluation strategies, and innovative approaches like simulation and case based learning. Research ensures that nursing education remains updated, evidence based, and effective. Second one is scope in clinical practice. In clinical practice, research promotes evidence based care. It helps in developing guidelines for infection control, pain management, pressure ulcer prevention, and many other standards. So, by applying research findings, nurses improve patient outcomes and enhance quality of care. Third one, scope in nursing administration. So, in administration, research supports planning and decision making. It helps in staffing policies, workload management, program evaluation, and resource utilization. Research allows administrators to make scientific and informed decisions. And the fourth one is scope in patient care. Most importantly, research improves patient care. It helps identify the risk factors, develop prevention strategies, and improve treatment protocols. Ultimately, nursing research ensures safe, effective, and high quality patient care. To conclude, nursing research strengthens education, enhances practice, supports administration, and improves patient outcomes. So, understanding research makes us more competent and professional nurses. So, guys, thank you for being part of today's session. Keep learning, keep questioning, and keep strengthening your nursing knowledge. For more structured and informative nursing videos, please subscribe to Learn Nursing with Anu. See you in the next video. Thank you so much.